London, 1842. A surgeon held down a screaming man and whispered something chilling into his ear. If you survive the pain, you deserve to live. He wasn't comforting him. He believed it. Every word. And so did most of his colleagues. The patient's leg was about to be sawed off without a single drop of anesthesia. The surgeon smiled. Not because he was cruel, but because he thought he was doing the right thing. Before we continue, answer this. If a doctor could save your life but had to make you suffer first, would you let him? Drop your answer below. Let's see who's brave and who's honest. Victorian surgery wasn't just a medical procedure. It was a philosophy, a test of human will wrapped in the language of science. When ether and chloroform became available in the 1840s, you'd think surgeons would have celebrated. Finally, a way to spare patients the unimaginable agony of having their bodies cut open while fully conscious. But many didn't celebrate. They resisted. Some outright refused to use anesthesia. And their reasoning? It wasn't ignorance. It was conviction. They genuinely believed that pain served a purpose. Pain kept patients awake. Pain kept them alert. Pain made them obedient. And most importantly, pain proved they were strong enough to survive. The logic was disturbingly simple. If you could endure the surgery, you could endure the recovery. If you passed out from the agony, well, that meant your body was weak. And weak bodies didn't heal, at least that's what they told themselves. So they kept cutting, kept sawing, kept burning, and the patients kept screaming. Let's go back to that young man on the table. His name was Thomas, 23 years old, a factory worker. His leg had been crushed in an industrial accident 3 days earlier. The bone was shattered. Infection was already creeping up his thigh, turning the skin a mottled greenish black. The smell was unbearable. Gangrene. If the leg stayed, Thomas would die. If it came off, he had a chance. A slim one, but a chance. The surgeon's name was Dr. William Harrison, mid-40s, respected, known for his speed. In the world of pre-anesthesia surgery, speed wasn't just a skill, it was mercy. The faster you cut, the less the patient suffered, at least in theory. Dr. Harrison could amputate a leg in under 3 minutes. He was proud of that, kept a pocket watch on the table during every operation, timed himself, competed with his own records like it was a sport. Thomas was brought into the operating theatre at St. Bartholomew's Hospital. The room smelled like iron and vinegar. Blood from the previous surgery still stained the floorboards. They didn't clean between patients. Why bother? More blood was coming. Always more blood. Thomas was strapped to the wooden table, leather restraints around his chest, his good leg, his arms. 4 assistants stood ready to hold him down. Even with the straps, patients thrashed. Survival instinct doesn't care about leather. Dr. Harrison entered. He didn't wear gloves. Nobody did. Germ theory was still decades away from being accepted. He wiped his hands on his apron, the same apron he'd worn all week, stiff with dried blood, a badge of honor in his profession. The more blood on your apron, the busier you were. The busier you were, the more lives you saved. That's how they saw it. Thomas looked up at him, eyes wide, terrified. "Please," he whispered, "give me something. Anything. I can't do this." Dr. Harrison placed a leather strap between Thomas's teeth. "Bite down," he said calmly. "This will keep you from swallowing your tongue. And Thomas, listen to me. The pain will keep you conscious. I need you awake. If you faint, I won't know if I'm cutting too deep. Your body will tell me when to stop. Do you understand?" Thomas didn't understand. How could he? But he nodded anyway. What choice did he have? Dr. Harrison selected his amputation knife, a long, curved blade, razor sharp. He'd sharpened it himself that morning. He made the first incision without warning. Skin split. Thomas's scream was immediate, raw, animalistic, the kind of sound that shouldn't come from a human throat. But Dr. Harrison didn't flinch. He kept cutting, circling the thigh, slicing through muscle in smooth, practiced strokes. Blood poured, hot, fast. The assistants pressed down harder as Thomas's body convulsed against the restraints. "Hold him steady," Dr. Harrison ordered. His voice was flat, bored almost. He'd done this hundreds of times. The screaming didn't bother him anymore. It was just noise, background ambiance to his work. He reached the bone, switched to the saw. This was the worst part. Not for him, for Thomas. The blade bit into the femur, back and forth, back and forth. The grinding sound mixed with Thomas's shrieks. His voice cracked, broke, turned into choking, desperate gasps. Tears and sweat poured down his face. His good leg kicked uselessly against the restraints. One assistant had to use both hands to keep Thomas's head from slamming against the table. 2 minutes and 40 seconds. That's how long it took. Dr. Harrison checked his watch. Not his fastest, but respectable. He dropped the severed leg into a bucket with a wet thud. Then he cauterized the stump with a red-hot iron. The smell of burning flesh filled the room. Thomas didn't scream this time. He couldn't. His voice was gone. His eyes rolled back, but he was still awake, still feeling everything. Dr. Harrison noticed, nodded approvingly. "Good," he said, wiping his blade on his apron. "You stayed conscious. That means you're strong. You'll heal. But here's what Dr. Harrison didn't tell Thomas. Here's what none of them talked about openly. Most patients didn't die from the surgery itself. They died hours later, sometimes days, from shock, from the trauma, from their brains simply refusing to process that level of agony. The body has limits. Push past them and something breaks. Surgeons had a term for it, surgical shock. They wrote about it in their medical journals, debated its causes, proposed theories, but they never blamed the method. They blamed the patient. Insufficient constitution, they'd write in their notes, weak vital forces, predisposed to nervous collapse. It was always the patient's fault, never the fact that they'd been tortured on a table for 3 minutes while a man sawed through their bones. Thomas survived the surgery, barely, but he never recovered. Not really. The physical wound healed, slowly, badly. The stump became infected twice, required further debridement, more cutting, more pain. But the psychological wound, that never healed. He developed what we'd now call PTSD, night terrors, panic attacks, couldn't stand the sight of doctors, couldn't be in enclosed spaces. The memory of that table haunted him until he died 6 years later, not from the leg, from drinking himself to death trying to forget. Dr. Harrison never knew, never asked. He moved on to the next patient, the next surgery, the next opportunity to prove his skill. And his beliefs about pain? They only grew stronger. Because here's the thing about Victorian surgeons and their relationship with pain. It wasn't just medical philosophy. It was religious, moral, cultural. Pain was built into the fabric of their society. The Victorians believed in suffering as virtue, in endurance as character. This was the era of spare the rod, spoil the child, of workhouses and poorhouses designed to be deliberately miserable, of the idea that comfort made people weak and lazy. Pain, in their worldview, was purifying, strengthening, a gift from God to separate the worthy from the unworthy, and medicine reflected that. When anesthesia first appeared, the backlash wasn't just from surgeons, it came from clergy, from moralists, from philosophers. They argued that pain in childbirth was God's curse on Eve, that removing it was blasphemy. They argued that soldiers who couldn't feel their wounds would become cowards. That pain taught discipline, that suffering built character. But let's be honest about what was really happening. Surgeons resisted anesthesia because it threatened them. Their entire identity was built around speed and nerve. They were the men who could cut into screaming flesh without hesitation, who could ignore the begging and the crying and keep working. That took a certain kind of person, a certain kind of coldness, and they were proud of it. Anesthesia made surgery easier, but easier meant less impressive, less heroic. Any doctor could operate on an unconscious patient, but operating on a conscious one, that took skill, that took guts. So they invented reasons, medical reasons, scientific-sounding reasons. They claimed that anesthesia was dangerous, which, to be fair, it was. Early anesthetics were unpredictable. Dosing was imprecise. People did die from chloroform, but here's what they didn't mention. People were already dying, in massive numbers. From infections, from shock, from botched surgeries performed too fast because the patient couldn't endure any longer. Anesthesia didn't make surgery more dangerous. It just made the deaths more visible, more blamable. If a patient died screaming in agony, that was natural, unavoidable, God's will. But if they died peacefully under anesthesia, that was the doctor's fault. Let me tell you about another surgeon, Dr. Robert Liston, famous, legendary even, known as the fastest knife in the West End, could amputate a leg in 28 seconds. 28 seconds. He once performed a surgery so fast that he accidentally amputated his assistant's fingers along with the patient's leg. Both the patient and the assistant died of infection. A spectator died of shock from watching. The only surgery in history with a 300% mortality rate. But Dr. Liston was celebrated anyway, because he was fast, and fast meant less pain, in theory. Dr. Liston actually did use anesthesia once it became available. He performed the first operation under ether in Britain, December 1846. The patient was a butler who needed his leg amputated. Frederick Churchill was his name. When Churchill woke up, he asked when the surgery would begin. Dr. Liston told him it was already over. Churchill didn't believe him. He insisted he would have felt it, would have remembered, but he didn't. He felt nothing. remembered nothing, and Dr. Liston, to his credit, realized something profound. This changed everything, but not all surgeons had that realization. Many doubled down on their beliefs, insisted that pain served essential functions that couldn't be replicated, and they had arguments that sounded reasonable if you didn't think too hard about them. They claimed that conscious patients could alert the surgeon to errors, that their reactions guided the knife, that their screams provided feedback about depth and pressure, all of which sounds logical, until you remember that the patient is in indescribable agony and not exactly providing calm, rational guidance about anatomical boundaries. They also claimed that anesthesia caused complications, that it depressed breathing, slowed heart rate, interfered with healing. And again, some of this was true. Early anesthetics were crude, but the solution wasn't to abandon them. It was to refine them, to study them, to make them safer. But that required admitting that the old way was wrong. And doctors don't like admitting they were wrong, especially when wrong means I tortured thousands of people unnecessarily for decades. Let me give you another example. A woman this time. Sarah, 31 years old, mother of 3, developed a massive tumor in her breast, the size of a grapefruit, growing fast. Painful, probably cancer, though they couldn't diagnose it properly back then. It had to come out. The surgery was called a mastectomy. Without anesthesia, it was one of the most brutal operations imaginable. Sarah was taken to the operating theatre of Guy's Hospital, 1838, 6 years before Ether. She knew what was coming. Everyone knew. Mastectomies had a reputation. Women would rather die than undergo one, but Sarah had children. She wanted to live, so she agreed. They didn't strap her down as tightly as they did for amputations. Mastectomies required a certain stillness that restraints couldn't provide. Instead, 4 nurses held her, arms pinned, shoulders pressed, head immobilized. The surgeon, Dr. Henry Klein, explained the procedure. He'd make an incision around the entire breast, peel back the skin, cut away the tumor and all surrounding tissue, remove lymph nodes from the armpit, then cauterize everything with a hot iron to prevent bleeding. He estimated it would take 8 to 10 minutes, maybe longer if the tumor had spread. Sarah nodded, pale, shaking. They gave her a piece of wood to bite, thicker than the leather strap. Women tended to bite harder than men, something about childbirth training them to redirect pain through their jaws. Dr. Klein had seen women crack teeth biting down during surgery, splinter the wood, bite through their own lips. He'd seen a lot of things. He made the first cut. Sarah's entire body went rigid. The sound she made wasn't a scream. It was worse. A high, keening wail that didn't stop, didn't pause for breath, just kept going, continuous, inhuman. The nurses pressed harder, held tighter. Dr. Klein kept cutting. He had to. Stopping meant starting over, meant more pain, longer pain, so he worked as fast as he could, slicing, peeling, cutting, blood everywhere, soaking through Sarah's surgical gown, dripping onto the floor, splattering his apron. When he reached the tumor, he had to cut deeper, into muscle, near the ribs. Sarah's wailing changed pitch, rose higher, broke into gasping, choking sounds. Her eyes bulged, face purple, body convulsing so hard the nurses struggled to hold her. One nurse was crying, silently, tears running down her face while she pressed Sarah's shoulder. Dr. Klein didn't notice, didn't care. He was focused. This was delicate work. One wrong move and he could puncture a lung, sever an artery. He had to be careful, precise, which meant taking his time, which meant Sarah had to endure. 9 minutes and 37 seconds. That's how long it took. Then the cauterization. The hot iron pressed against raw, exposed flesh. Sarah stopped making sounds. Her jaw went slack. Wood fell from her mouth. Eyes still open but vacant, staring at nothing. Dr. Klein checked her pulse. Still beating. Strong even. Good. She'd survived. He stitched her up. Rough, quick stitches. No anesthetic for that part either. But Sarah didn't react. She was somewhere else. Mentally gone. The body's last defense against unbearable pain. Dissociation. The mind fleeing the flesh. She came back hours later, in her bed, in agony, the wound screaming. But the surgery was over. She was alive. Dr. Klein called it a success. Sarah lived for another 14 years. The tumor didn't come back. In medical terms, the surgery worked, but Sarah was never the same. Never touched her remaining breast. Never let her husband see her without clothes. Developed a terror of doctors that extended to all men in dark coats. Her children said she aged 20 years in those 9 minutes. Became brittle, fragile, jumped at sudden noises. Had nightmares where she was back on that table, forever being cut, forever screaming, forever trapped in those 9 minutes and 37 seconds. Dr. Klein wrote about her case in a medical journal, praised her fortitude, her strength, called her an exemplary patient, never mentioned the psychological destruction, the permanent trauma, because that wasn't his concern. His concern was the tumor, and the tumor was gone. Everything else was irrelevant. This is what Victorian surgeons didn't understand, or chose not to understand. They saw the body as a machine, pain as a signal, suffering as temporary, but the mind isn't a machine. Trauma isn't temporary. You can't cut into a person's flesh while they're screaming and begging and expect them to just bounce back. The wound heals. The memory doesn't. But they kept doing it, kept believing their own justifications, and those justifications became more elaborate as anesthesia became more common. By the 1850s, most surgeons were using ether or chloroform, but a stubborn minority refused, and they wrote. Oh, they wrote. Medical papers, opinion pieces, treatises on the necessity of pain. They argued that anesthesia interfered with the body's natural healing processes, that consciousness during surgery stimulated vital forces, that pain triggered physiological responses essential to recovery. None of it was based on evidence. All of it was based on ego. One surgeon, Dr. James Simpson, conducted a study. He compared outcomes between patients who received anesthesia and those who didn't. Same types of surgeries, same time period, same hospital. The results were clear. Patients under anesthesia had lower mortality rates, fewer infections, faster recovery times, less psychological trauma. He published his findings in 1847. The anti-anesthesia surgeons dismissed it, called his methodology flawed, his sample size too small, his conclusions premature. They had 100 reasons why his study didn't count, but zero evidence supporting their own position, because here's the truth they couldn't admit. They liked the pain, not in a sadistic way, not overtly, but it made them feel powerful, important, heroic. Operating on a screaming patient required nerves of steel, emotional detachment, the ability to override your natural human empathy and keep cutting while someone begs you to stop. That's not easy. Most people couldn't do it, but they could, and that made them special, superior. Men apart from ordinary men. Anesthesia threatened that identity, made surgery ordinary, made them ordinary, and they couldn't accept that. So they kept finding patients who agreed to surgery without anesthesia, usually poor patients, workhouse patients, people who couldn't afford to be choosy, people who didn't know they had options. The surgeons would tell them anesthesia was experimental, dangerous, might kill them, but the surgery itself, that was safe, proven, necessary. The patients believed them. Why wouldn't they? These were educated men, doctors, professionals. If they said pain was part of healing, then pain was part of healing. One case stands out, a man named John, 47 years old, bladder stones, excruciating condition, felt like shards of glass in your urine, constant pain, made worse by the surgery to remove them. Lithotomy, they called it. The surgeon would cut into the perineum, the area between the genitals and anus, reach in with forceps, and pull out the stones. Without anesthesia, it was torture, pure, distilled torture. John was told he needed the surgery, that the stones would eventually kill him, block his urethra completely, cause his bladder to rupture, poison his blood. Death would be slow, agonizing, but the surgery could fix him, make him healthy, normal. He just had to endure the procedure. They didn't mention that anesthesia was available, that he could sleep through it, feel nothing, remember nothing. They didn't mention it because his surgeon, Dr. Marcus Webb, didn't believe in anesthesia, thought it was cowardice, weakness. A man should face his pain, own it, prove his worth through suffering. John was positioned on the table, legs spread, strapped into stirrups, exposed, vulnerable, humiliated before the cutting even started. Dr. Webb made his incision. John screamed, but not like Thomas, not like Sarah. This scream had a different quality, higher, sharper, because this pain was different, more intimate, more violating. The scalpel cutting through some of the most sensitive tissue in the human body, areas dense with nerve endings, areas never meant to be touched by metal. Dr. Webb worked his way deeper, cut through layers, muscle, fascia, until he reached the stones, could feel them under his fingers, hard, irregular. He grabbed the forceps, pushed them into the wound, spreading the incision wider. John's screams turned to animal howls, raw, primal, the sound of a creature being destroyed. Dr. Webb clamped onto a stone, pulled. It was stuck, embedded in tissue. He pulled harder, twisted. The stone broke free, came out with a wet, tearing sound. John's body arched, bucked. The restraints held, barely. There were more stones. Dr. Webb went back in, again. Each extraction a fresh hell, fresh trauma, fresh violation. By the fourth stone, John wasn't screaming anymore. He was making a low, continuous moaning sound, like an engine running, mechanical, inhuman. His eyes were open but seeing nothing. Blood and urine mixed on the table, ran onto the floor. The smell was overwhelming. Copper and ammonia, sharp enough to burn the nostrils. Dr. Webb finished. 14 stones removed, various sizes. He arranged them on a tray, showed them to the observers who'd come to watch. Medical students, junior surgeons, learning their craft, learning to cut without flinching. They applauded, politely, professionally. Dr. Webb nodded, satisfied, turned back to John. Began stitching, rough stitches, thick thread, no gentleness, no care for cosmetic appearance, function over form. The wound just needed to close, needed to heal. How it looked didn't matter. John survived, physically. The stones were gone. The infection cleared. The wound closed. But John was destroyed. Couldn't urinate without panic attacks. Couldn't be touched by his wife. Couldn't see male doctors. Couldn't be in rooms with closed doors. Developed insomnia. Stopped eating. Wasted away. Died 8 months later from what the death certificate called nervous exhaustion. What we'd call suicide by neglect. He'd simply stopped trying to live. The memory of that table, those forceps, that violation, it killed him slower than the stones would have, but it killed him just as surely. Dr. Webb never made the connection, never questioned his methods. He wrote about John's case too, praised the successful removal of 14 bladder stones, noted the patient's survival, called it a triumph of surgical technique. The subsequent death? Unrelated. A weak constitution finally giving out. Nothing to do with the surgery, nothing to do with the pain, nothing to do with the trauma, just one of those things. Unfortunate, but unrelated. This is the pattern, over and over. Surgeons inflicting unimaginable pain, patients surviving the surgery but not the memory, and doctors never connecting the dots, never accepting responsibility, never questioning whether their philosophy of pain might be wrong, because accepting that would mean accepting that they'd been harming people, unnecessarily, for years, for decades, and that was too heavy a truth to bear, so they didn't bear it. They rationalized, justified, deflected, and kept cutting, even when the evidence became overwhelming, even when study after study showed better outcomes with anesthesia, even when patient testimony made it clear that conscious surgery was traumatic. They held on, a core group of surgeons who believed, truly believed, that pain made better patients, that suffering built character, that the old ways were the right ways. They performed their last conscious surgeries in the 1860s and 70s, decades after anesthesia became standard, decades after it was proven safe and effective. They just couldn't let go. Why? Because admitting they were wrong meant admitting they'd tortured people, meant looking back at all those screaming patients and realizing they could have been spared, should have been spared. That's a guilt too profound to process. So instead, they rewrote the narrative, told themselves that those patients were heroes, warriors, that they'd been tested and proven strong, that their pain had meaning, purpose, value, that it wasn't torture, it was medicine, and they were healers, saviors, not torturers, never torturers. The patients screamed because the body screamed, but the mind understood. The soul was grateful, or so they told themselves, so they needed to believe. But let's pull back, look at the bigger picture. Why did this happen? Why did intelligent, educated men convince themselves that causing pain was beneficial? It wasn't just ego, it wasn't just tradition, it was fear. Fear of change, fear of losing status, fear of admitting error. The Victorian era was obsessed with progress, industry, empire, the idea that humanity was advancing, improving, perfecting itself. But medicine lagged behind. Surgeons were still using techniques from the Middle Ages, still had mortality rates above 50% for major surgeries, still couldn't explain why some patients healed and others died from infections. They were supposed to be scientists, men of knowledge, but they didn't know, didn't understand, were basically guessing, hoping, praying. Anesthesia threatened to expose that. Because if you could remove pain, patients would survive longer surgeries, more complex surgeries, surgeries that revealed how little doctors actually knew about anatomy, about physiology, about infection, about healing. Pain had been a convenient excuse, a natural limit. You couldn't operate for more than a few minutes because the patient couldn't endure it. But with anesthesia, you could take your time, go deeper, do more. And when patients still died, when infections still ravaged wounds, when surgeries still failed, there'd be no excuse, just incompetence, exposed, undeniable. So some surgeons rejected anesthesia not because they believed pain was beneficial, but because they knew it would reveal how inadequate they were, how primitive their methods, how limited their knowledge. Pain kept surgery brief, brief kept their failures limited. Anesthesia meant longer surgeries, more opportunities to fail, more evidence of their inadequacy. Better to blame the patient's weakness than their own ignorance. But time doesn't care about ego. Progress doesn't pause for pride. By 1870, anesthesia was universal. The holdouts retired or died. A new generation of surgeons emerged who'd never known surgery without it, who saw conscious surgery as barbarism, cruelty, medical malpractice. They looked back at their predecessors with a mixture of horror and disbelief. How could they have done that? How could they have believed that? What kind of men were they? But here's the uncomfortable truth. They weren't monsters. They were ordinary, products of their time and culture, believers in the philosophies and values that surrounded them. They thought they were right, thought they were helping, thought pain served a purpose because their entire worldview told them that suffering built character, and they'd been trained by men who believed it, taught by men who practiced it, surrounded by colleagues who reinforced it. It takes tremendous courage to stand against that, to question everything you've been taught, to admit that your mentors were wrong, that you've been wrong, that you've harmed people while trying to heal them. Most people don't have that courage. These surgeons didn't, so they kept believing, kept cutting, kept justifying, until they couldn't anymore, until the weight of evidence and the judgment of history crushed their rationalizations. But by then the damage was done. Thousands of patients tortured, traumatized, destroyed, all in the name of medicine, all in the service of a philosophy that valued endurance over mercy. And the saddest part? Some of those surgeons went to their graves still believing they'd been right, still insisting that pain made better patients, still proud of their strength, their resolve, their willingness to do what was necessary, never understanding, never accepting, never seeing the truth that was obvious to everyone else, that they'd been cruel, that their patients had suffered unnecessarily, that their philosophy was wrong. They died believing they were heroes. History remembers them differently. So why did Victorian surgeons believe pain made better patients? Because they had to. Because the alternative was unbearable. Because accepting that anesthesia was safe and effective meant accepting that they'd tortured people for years, for decades, for no reason, and that's not a truth anyone wants to carry. So they invented justifications, created philosophies, built elaborate rationalizations, convinced themselves that pain was necessary, beneficial, part of healing, and they believed it, truly believed it, because the human mind will do anything to protect itself from guilt, anything to avoid confronting its own cruelty, anything to maintain the illusion that we're good people, healers, helpers, not torturers, never torturers, even when the screaming says otherwise, even when the evidence proves it, even when history judges us. We believe what we need to believe, to survive, to function, to sleep at night. These surgeons were no different. They believed because they had to, because the truth would have destroyed them, so they destroyed their patients instead, and called it medicine, and slept soundly, believing they'd done the right thing, the necessary thing, the heroic thing. They were wrong, but they never knew it, and maybe that's the real horror. Not the pain they inflicted, but the certainty with which they inflicted it, the confidence, the pride, the absolute conviction that they were right. That's what makes this story so disturbing. Not that people suffered, but that the people causing the suffering thought they were helping, believed they were noble, were celebrated for their cruelty and died as heroes. That's the nightmare, that's the lesson. That good intentions don't excuse bad actions. That conviction doesn't equal correctness. That being educated and respected doesn't mean you're right. Sometimes the healers are the ones causing harm. Sometimes the experts are the ones spreading ignorance. Sometimes the heroes are the villains. And they never know, never see it, never accept it. They just keep cutting, keep believing, keep justifying, until someone stops them, until progress overtakes them, until history reveals what they really were. Not heroes, not healers, just people, flawed, frightened, clinging to beliefs that protected them from truths they couldn't face. And their patients paid the price, screamed the price, bled the price, died the price, while the surgeons congratulated themselves on their fortitude, their skill, their commitment to medical excellence. Medicine saved lives. But it destroyed much more first.